Have you ever just felt totally overwhelmed? Trying to figure out weight management, wading through all the information, or maybe you felt that frustration when another diet just doesn't work out long term. If that sounds familiar, well, this deep dive is definitely for you. Today, we're moving beyond just talking about simple diets. We're really going deep into this whole evolving world of weight management. We'll explore structured programs, was really rethinking our approach to food, and also get into that groundbreaking class of meds, the GLP-1s. Our mission here is pretty straightforward. Cut through all that noise for you. We want to unpack the science, look at how effective these things are, weigh the trade-offs, and really lay out the real-world implications. We're drawing all this from the sources you've shared with us. Think of it as your shortcut, yeah, to understanding what actually matters in this space. Okay, so let's start unpacking this. Why is weight management such a persistent challenge? I mean, for so many people, the numbers are kind of staggering, aren't they?
Yeah.
Over 40% of adults in the U.S. dealing with obesity right now, and it's projected to hit almost 50% by 2030. And, historically, just relying on diet and exercise alone, well, it often hasn't led to that lasting success for most. It makes you wonder, are we missing something fundamental?
That's a really crucial question. And what's becoming clearer, I think, is this important difference between just a diet and a full-on weight management program. A diet, well, it often means temporary restriction, right? Maybe a specific menu, often not much ongoing support. It's mostly about what you eat.
Right, like a short-term fix.
Exactly. But a weight management program, think Weight Watchers, think Noom, provides a much more structured framework. These programs give you tools, guidance, support that's designed to evolve with you. They aim to take the guesswork out of it, offer a kind of roadmap. And a lot of people find that structure really helpful for, long-term change. It shifts the focus to how you relate to food, your habits.
That distinction makes a lot of sense. So if those simple diets often fall short, what are these newer, maybe smarter paths that are emerging? It seems like technology is playing a massive role now, kind of reinventing the approach. And Noom comes up a lot as an example of that shift.
Yeah.
What makes their digital approach stand out?
Yeah, Noom really does position itself differently. They call it a lifestyle, not just a diet. And I think its core strength isn't just, say, the food logging. It's how it uses psychology. Specifically, principles that are pretty similar to cognitive behavioral therapy, CBT.
CBT. Okay, remind us quickly what that is.
Sure. So CBT is basically a therapeutic technique that helps you identify and then change unhelpful thought patterns and behaviors. Noom applies this logic to your relationship with food. It tries to move beyond just what you're eating to really understanding why you're eating the way you do. That's the key difference, I think.
The why behind it all.
Exactly. They do use a color-coded system for foods green, yellow, and orange, but it's not just about calories. It's based on calorie density and nutrient density. So green foods are less dense. Calorically, think fruits, veggies, whole grains. Yellow is for moderation, lean proteins. Orange foods are the most calorie dense, things to eat in smaller amounts. It helps visualize where calories stack up.
Okay, so it guides choices visually.
Right. And beyond that, the app offers weekly challenges, lots of educational content, things like stress management, goal setting, plus, of course, the tracking tools for food, exercise, weight, and there's virtual coaching, support through online communities. The sources we looked at really highlight how this psychological angle gets at the why behind habits, aiming for changes that stick. One tester mentioned it really helped them finally understand their own eating patterns, figure out where to even start making changes.
That is fascinating. So it's digging deeper than just counting calories. It's about the mental side of eating. Did the sources mention impacts beyond weight loss itself?
Oh, absolutely. There was a 2021 survey, pretty large, nearly 3,500 people who'd used Noom for at least 6 months, and it showed some really impressive shifts in mental well-being. They reported, on average, a 20% jump in overall mental wellness, a 14% decrease in anxiety, 18% drop in stress.
Wow, those are significant numbers.
Yeah. They really are. And it seemed to have knock-on effects, too, like a 37% increase in energy levels, a 34% boost in confidence. It suggests that by tackling those psychological roots of eating behaviors, these kinds of programs can foster, holistic improvements, not just pounds lost on the scale.
That's a pretty strong case for that structured, psychology-based approach. So if someone's looking for that kind of robust, tech-supported help, what other options are out there besides Noom?
Well, Weight Watchers is still a major player, obviously. They continue with their flexible point system, starting around, I think, $23 a month. And interestingly, Weight Watchers has also adapted, hasn't it? They launched a clinic that actually provides access to GLP-1 medications for people who qualify, so they're integrating medical support now, too.
Integrating the meds, right?
Exactly. And then there's Wello's. Their focus seems more on one-on-one coaching and video content. That one's priced around $24.99 a month. So you see, there's a growing variety of support models emerging: behavioral science, community focus, direct medical access.
Okay, this perfectly sets up our next big topic, what many people are calling a real game changer. This is where it gets really interesting, folks. Let's talk GLP-1 medications. For anyone who might not be totally familiar, what exactly is GLP-1 and how do these drugs actually work in the body?
Okay, so think of GLP-1, that stands for glucagon-like peptide 1, as basically your body's own natural I'm getting full hormone. It's a peptide hormone that your intestines release when you eat food. Its primary job is signaling the pancreas to release more insulin, but only when blood sugar levels are high. This helps bring down blood sugar after meals.
Okay, so it helps manage blood sugar.
Right. And crucially, because it's glucose dependent, meaning it only really kicks in when sugar is high, it has a lower risk of causing hypoglycemia, or dangerously low blood sugar, compared to some older diabetes meds. But it does more than that. GLP-1 also slows down gastric emptying, how quickly food leaves your stomach.
Hence the feeling fuller longer.
Precisely. It makes you feel satiated for a longer period. It also suppresses glucagon, which is a hormone that tells your liver to release more sugar. And importantly, it acts directly on appetite centers in the brain to reduce hunger and overall food intake.
So it tackles appetite from multiple angles.
Exactly. Now, the challenge with your body's natural GLP-1 is that it gets broken down really fast. Its half-life is only about 2 minutes.
2 minutes, that's incredibly short.
It is, so it doesn't stick around long enough to have a sustained effect on weight. That's why these medications, the GLP-1 receptor agonists, were developed. They essentially mimic the action of natural GLP-1, but are engineered to resist that rapid breakdown. They provide a much longer-lasting signal to your body and brain. It's like giving your system a powerful biological reset, targeting mechanisms where, maybe willpower alone has struggled.
A biological reset, I like that framing. So it's a supercharged version of what our body does naturally. That certainly helps explain the incredible buzz around drugs like Ozempic, Wegovy, Mounjaro, Zepbound. What's really driving this sudden massive popularity?
Well, it's really a perfect storm of factors, I think. First, you just have the sheer scale of the obesity epidemic globally. There's enormous unmet need for truly effective medical treatments. Then, as we discussed, traditional lifestyle changes, while absolutely vital, haven't consistently delivered major long-term weight loss for everyone. These drugs offer a fundamentally new mechanism hitting those appetite pathways directly.
And the results themselves.
And the results, frankly, are unlike almost anything we've seen before in pharmaceuticals for weight loss. We're talking average weight loss in clinical trials, often hitting 15%, sometimes even over 20% of initial body weight. That's substantial.
Huge numbers.
Huge. And then, of course, you can't discount the impact of celebrity endorsements and, social media hype. That's definitely amplified awareness and demand massively.
Okay, so let's talk specifics on efficacy. How do these different GLP-1s stack up against each other?
Yeah, looking at the clinical trials gives us a good picture. The Step 8 trial, for example, directly compared once-weekly semaglutide, that's the active ingredient in Ozempic and Wegovy, at the 2.4 milligram weight loss dose, against once-daily liraglutide, an older GLP-1. The results were pretty stark. Over 68 weeks, the semaglutide group lost an average of 15.8% of their body weight.
15.8%.
Compared to just 6.4% in the liraglutide group. And importantly, far more people on semaglutide achieved those significant weight loss milestones like 10%, 15%, or even 20% loss.
Much higher chance of major results then.
Significantly higher. For instance, over 70% of the semaglutide users lost at least 10% of their weight, compared to only about 26% of the liraglutide users. And now there's tirzepatide, that's Mounjaro, and Zepbound, which is actually a dual agonist, hitting both GLP-1 and another hormone receptor called GIP. Tirzepatide has shown even higher average weight loss in its trials, reaching up to 21.4% at its highest dose.
Wow, over a fifth of body weight on average.
Yes. Now, it's really crucial to remember all these major trials included lifestyle intervention, diet, and physical activity counseling alongside the medication. It underscores that the best outcomes really come from that combined approach.
Right. It's not just the drug in isolation. Those numbers are incredibly compelling, though. It really does feel like a new era. But as with any powerful medication, there are always other sides to the coin. Considerations. What about the side effects? What are the common ones? And maybe the rarer, more serious risks that people should really be aware of with these GLP-1s.
That's absolutely critical to discuss, and having a balanced view is key. For most people, the most common side effects are gastrointestinal, things related to your stomach and digestion. You might experience nausea, that's probably the most frequent, maybe affecting up to 40% of patients initially. Diarrhea is also common, maybe 12-15%. Vomiting, abdominal pain, those happen too, maybe around 10%.
Okay, mostly stomach upset then. Does it last?
The good news is these tend to be mild to moderate for most people. They are often transient, meaning they don't last forever. They're usually most noticeable during the initial period when the dose is being increased as your body adjusts. They generally get better over a few days or weeks for many people. Careful dose titration helps manage this.
Okay, that's reassuring for the common stuff.
Yeah.
What about the less common but potentially more serious risks?
Right. So rarer risks need attention. There is an observed increased risk of gallbladder-related issues. Things like cholelithiasis, that's gallstones, or acute cholecystitis, which is inflammation of the gallbladder. This seems potentially more likely with higher doses used specifically for weight loss and perhaps longer duration of use.
Gallbladder issues. Okay, what else? Pancreatitis comes up sometimes?
Yes, acute pancreatitis. It's a bit nuanced. Some studies show a statistically higher chance of elevated pancreatic enzymes, which are markers for pancreas stress. However, larger meta-analyses looking across multiple studies haven't generally shown a statistically significant difference in the actual development of acute pancreatitis or pancreatic cancer compared to placebo. But if you have a history of gallstones or previous pancreatitis, your individual risk might be higher, so that's an important consideration.
Okay. Anything else on the serious risk front?
Well, there's a small but consistent increase in resting heart rate noted in trials, usually around 2.5 to 3.5 beats per minute. Mental health concerns have also been discussed, things like depression or suicidal thoughts. Clinical trials, however, generally did not find a statistically significant difference compared to placebo. Some studies even hinted at mental health improvements, possibly linked to weight loss itself.
So the trial data is mostly reassuring there.
Mostly, yes. The FDA does include warnings to monitor for mood changes, and many trials excluded people with a history of major depression or suicidality. But importantly, large recent real-world studies have found no causal link between these drugs and suicidality. Hypoglycemia, low blood sugar, is really only a significant risk if you're also taking other medications that lower blood sugar, like insulin or sulfonylureas. On its own, GLP-1 risk is low. And regarding tumors, specifically thyroid cancer, there's been no reported increase in medullary thyroid carcinoma or C-cell hyperplasia in humans. Overall rates of benign or malignant tumors weren't significantly different, although some studies noted slightly more breast neoplasms with liraglutide specifically.
It's a very thorough overview of the known risks, thank you. Are there any sort of newer considerations emerging now that these medications are being used so much more widely?
That's a great question. And yes, as usage becomes widespread, we learn more. One important aspect is that delayed gastric emptying we talked about earlier, while it helps with satiety.
Right, the fullness factor.
It does have implications for certain medical procedures. For instance, during anesthesia for surgery, there's an increased theoretical risk of aspiration stomach contents coming up into the lungs because the stomach isn't emptying as quickly. So, current recommendations often suggest withholding the medication for a period before scheduled procedures. The exact time depends on the drug's half-life, but for something like weekly semaglutide, it could be around 3 weeks.
3 weeks beforehand, wow.
Yes. Or if stopping isn't feasible, anesthesiologists might use specific techniques like rapid sequence intubation to protect the airway. Also, related to slow digestion, some studies suggest GLP-1 use might be linked to poor quality bowel preparation before colonoscopy, so you might need an adjusted prep plan if you're on these meds and need that procedure.
Interesting practical considerations.
Definitely. But, putting it all in perspective, from a clinical standpoint, for most adults dealing with obesity and its related health issues, the benefits of these medications, significant weight loss, improved blood sugar control, potential cardiovascular benefits often outweigh these risks. Remember, obesity itself carries major risks for heart disease, stroke, many cancers. The key is always careful patient selection, a thorough medical history, a good physical exam. These are essential, and these meds must be used under healthcare professional supervision, with individualized dosing and slow escalation to minimize side effects. Sometimes staying on a lower dose longer is needed for tolerance.
That makes sense. It's about weighing the individual benefit versus risk. Okay, this science is incredibly powerful, really offering new hope. But let's get down to earth for a moment. What about the real-world hurdles? Cost, access. how are people actually getting these?
You've absolutely hit on a critical, practical point. The list prices are high, no doubt. We're talking roughly $900 to $1,300 per month, depending on the specific drug and dose.
Oof, that's a lot.
It is. Now, it's important to understand that the net cost, what insurers or health systems actually pay after rebates and discounts, is often significantly lower. But if you're uninsured or you have a very high deductible health plan, you might be facing those full list prices out of pocket, which is prohibitive for many.
And Medicare's big issue here, too.
A huge issue. Current U.S. federal law actually prohibits Medicare Part D plans from covering medications when prescribed specifically for weight loss. This is a major barrier for millions of older adults who could potentially benefit.
What about private insurance, commercial plans?
Coverage there is still pretty limited specifically for the weight loss indication. Estimates suggest only around 25% of commercial plans and employers cover these drugs for weight management right now. That figure is projected to grow, maybe to around 40% by 2024, but progress is slow. Insurers often push back, citing the high costs, so it creates this real patchwork of access, a real challenge.
Definitely a barrier. So given all of this, the effectiveness, the risks, the cost issues, what does this mean for the long haul? Are GLP-1 medications like a short-term fix, or are they something more fundamental for managing weight long-term?
That's really the million-dollar question, isn't it? And it's crucial for people to understand. GLP-1s are generally not a cure for obesity in the sense that you take them for a while and you're done. Their weight-lowering effects typically persist only as long as you continue taking the medication regularly. If you stop treatment,
The weight comes back.
generally, yes. Studies show significant weight regain after stopping. This really positions these medications as tools for chronic management. It's similar to how we manage other lifelong conditions, like high blood pressure or type 2 diabetes, often requiring ongoing treatment. Obesity is increasingly understood as a chronic, complex, relapsing disease, and these drugs offer an effective long-term medical strategy within that framework.
So lifelong treatment for many, potentially.
For many who choose this path and find it effective, yes. And this brings us back to lifestyle. It's absolutely critical. Combining GLP-1 therapy with sustained lifestyle changes, better nutrition, regular physical activity, stress management, good sleep habits is key for optimizing how well the drugs work and for maintaining results long-term.
The medication isn't magic on its own.
Not at all.
Yeah.
It's a powerful tool, but it works best as part of a comprehensive plan. Healthcare providers almost always recommend behavioral coaching alongside the medication to support those necessary lifestyle shifts. And we're seeing the digital health world respond to this, which is interesting. Companies like Noom, with their new med service, and Weight Watchers, through acquiring the telehealth platform Sequence. They're actively integrating medication access and management with their virtual lifestyle coaching programs. The goal is to offer a more holistic, hopefully more affordable, and definitely more accessible approach.
Bring it all together. Interesting. So we've covered a lot of ground today. We've gone from the evolution of structured weight loss programs really tapping into psychology to the, frankly, remarkable power and effectiveness of these GLP-1 medications. But we've also really stressed the importance of understanding the side effects, both common and rare. And we've touched on those very real-world issues of cost and access and framed these drugs as long-term management tools, ideally working hand-in-hand with comprehensive lifestyle changes. Okay, so considering these rapid advancements, this potential to really reshape how we approach weight and health, it leaves us with a final thought to ponder, doesn't it? What responsibility do we have as individuals, yes, but also as a society to make sure these powerful new medical tools are used ethically, equitably, sustainably? How do we best leverage them to genuinely improve public health across the board, rather than just becoming another tool that mainly treats symptoms for those who can afford it? Something to definitely think about.